Okay, hi, it's Julien Barker from Street Chiropractic. I'm here again with Steve. We've been looking after his shoulder, which he's just telling me is actually okay doing his training and doing martial arts. It's actually when he's working here, massage, putting some pressure on that, so we just need to obviously keep that good so we can look after everybody. Fantastic. So, knees there and climb up. And like a lot of shoulder issues, they're usually complicated. You've got tendons and ligaments and complex patterns of movement. And then life goes on. You can't really do any normal life without involving your hands and shoulders, especially if you happen to work in manual therapy. And so the actual repetitive and continuous nature of adjusting somebody, you're trying to increase their healing rate in spite of them having to do everything they need to do. So quite typical with shoulders that they can be a real challenge. Okay. And Steve is consistently a right PD. Yeah, not too far off there, kind of 5-6 mil. And a very clear right PI ilium, spinal ischium, sacrotuberous ligament, and then into the iliac fossa there. Yeah, which has nearly cleared it, nearly leveled him out, not quite, so we will go with that AS ilium. So, yep. Squeeze your knees together and let go. Good. Right hand up behind your back. Swap your hands around. Both hands up behind your back together. Both back down by sides. Quite a clear L5 on the left. Okay, take your right hand up by your face. Big deep breath in and out. Left hand up as well. And both back down by sides. T8 on the left as well. Okay, let's turn your head to the right. Lift the right shoulder off the couch and back down. Shrug both shoulders up towards your ears and back down. Squeeze the right elbow flat against your side and let go. Squeeze the left one in and let go. Okay, shrug your shoulders up and roll them back. Okay, and take it back into the centre. So T1 on the left and then a right medial left lateral scapular pattern, which is very typically comes up with people who spend a lot of time working manually with their hands, be they farmers, builders, or in this case massage therapists. And where we are here in this part of the world, very true with all the people that are regularly managing animals and mucking out from horses, cows, and we're just at the start of the lambing season here. So Lots of manual work going on out there. People using their bodies as the tool, and like any complex tool with lots of moving parts, it can do with some maintenance, service and wellness care, as we would call it. Okay, let's lift up your head and back down. And tuck your chin down to your chest and back to centre. Okay, let's see, one lateral so. I'm going to get behind me here. And so I'm just dropping off, finding Steve's atlas. And adjusting straight immediately. Yep. I can feel the legs have gone, the tension's gone out of the legs there, and that's definitely had a big effect. Stretch your right hand towards your right knee, and let go. Left hand, left knee, and let go. And be very clear, right QL. QL muscle is part of the stabilising mechanism for any load or pressure that's put on the left shoulder. This muscle is going to have to contract to stabilise the spine to allow the shoulder to be loaded up. So you often see that relationship happening. Okay, just push both knees down into the couch and let go. That's good. Put palm of left hand up onto the back of your neck. Lift that elbow up off the couch and back down. Push the elbow down into the couch and let go. Okay, arm back down by side. So the first one, the superior scapular test, was very clear. To the spine of the shoulder, and just the line of drive is directly inferior. Just turn your head to the right, tip the back of your head towards your left shoulder. Yep, and head back into centre. So this is the test for upper trapezius, and you're picking up a very clear upper trapezius trigger point. Got my finger right on it, very clear, right in the belly of that muscle. Okay, so with Steve, initially we had an issue with the T5 coming up regularly, so let's just double check that. So turn head to the right, take your left hand up above your head. Okay, and a big deep breath in and out. Yeah, no, that's okay. Arm back down by side. We just check a couple of other, let's run through the rotator cuff muscle test. So take your left hand up behind your back as far as you can get it. Which is the isolation test for supraspinatus, that's okay. Back down by side. Just drop the arm off the side. Just push with your hand towards your feet. So push hard. So, and let go. Yeah. Challenging subscapularis. So that's okay, and going the other way, push up and let go. Is infraspinatus, and yeah, that is very clearly what's going on. And up. So it's usually 2, sometimes 3 trigger points in the infraspinatus. Very much corresponding with acupuncture points here. And those 2 points can definitely give pain running right all the way down here. settle around the thumb, so it's worth just checking what's going on with thumb, and massage therapists tend to work their thumbs quite hard. So just make a fist with your left hand and with your thumb on the inside, so that's it. Oh, there you go. And let go. So the standard thumb, we just get into the end of the thumb joint there. Okay. Good, and I'm going to stop there. That's how we're going through the shoulder, and we will see how Steve gets on next time. So, nice to see you. See you next time.